Today we'll be talking about the 10 rights of medication administration. The first right is the right drug. So you want to make sure that the correct drug is given, so you want to make sure that the name on the drug is correct. The two examples that I'm going to give you are acetazolamide, hexamide, and acetazolamide is used for high altitude sickness and glaucoma, and acetohexamide is used for type 2 diabetes sugar control. These are two very different drugs for very different purposes. The second right of medication administration is to have the right patient. So you need two forms of identification to make sure it's the right patient. The two examples I will be giving you, the first one is ask the patient their name, their full name. So this man is John Smith. The second thing you're going to check is to make sure that they are the right person by checking their identification bracelet. So this person's is John Smith, and he was born January 1st, 1963. The next right of medication administration is the right dose. So you want to make sure that the patient is receiving the correct dose for whatever they are using the medication for. So you need to check the doctor's orders along with MAR, or medication administration record, to verify the correct dose. The fourth right of medication administration is the right route. For this, you need to make sure that the person is receiving the right medication by the right way. Is it oral? Is it via IV? Is it subcutaneous? Is it intramuscular? Is it another form? Does it need to be crushed? Can it be crushed? How are you giving this medication? The fifth right of medication administration is the right time or frequency. So you need to check the order to see when the last time it was given, when should it be given. Say the drug was given at 6 o'clock and it's Q4H, which is every 4 hours, you need to give that medication at 10 o'clock. So there are many things that the order could say. It could say AC, which is before meals, PC, after meals. Is it in the morning? Is it in the evening, AM or PM? Is it Q4H every 4 hours, Q8H every 8 hours, or is it PRN? So which means whenever the person needs it. The sixth right of medication administration is the right documentation. So you need to make sure that you have the time written down, who gave the medication written down, and any other notes associated with the medication. Do you need to take an apical pulse, blood pressure, heart rate, or any other notes? If the medication creates drowsiness, write that the patient was drowsy. The seventh right of medication administration is the right history. So you want to make sure when the patient's last meal was, what was their last meal, how long ago was it. You also want to know what medications they're on, any other drugs they've taken that day, any over-the-counter medications they have taken, any recreational drugs, or naturopathic drugs that they do take. You also want to know, do they have any allergies that they're aware of? Are they allergic to food, as in dairy, or a food sensitivity? Any medications that they're allergic to, penicillin, anything along those lines, or any other allergies that they do have, grass, dander, something like that. The eighth right of medication administration is the right education. The patient needs to be informed of what they're taking and know all of the risks and benefits of their medication so that they can make an educated decision on whether the medication is the proper medication for them. The ninth right of medication administration is the right to refuse. So the patient can say that they do not want a medication because, for example, it makes them drowsy, and they have the right to do this, but we also have the right to educate this patient on why they should take it and why their concerns are valid. When we have educated the patient on the risks and benefits of not taking this medication, they still have the right to refuse to take this medication. The 10th right of medication administration is the right evaluation. So did the desired effects happen? Was their pain decreased? Was their blood pressure decreased? Was their heart rate decreased? Or was there an adverse effect? Did their pain increase? Did they have an allergic reaction? Did something bad happen because of this medication that was given? So to review, these are the 10 rights of medication administration. Number 1 is right drug, 2 is right patient, 3 is right dose, 4 is right route, 5 is right time, 6 is right documentation, 7 is right history, 8 is right education, 9 is right to refuse, and 10 is right evaluation after the medication is given. Thank you for your time. I hope this was educational in learning your 10 rights of medication administration.